There are so many different types of x-rays that we have at our disposal in order to make a right diagnosis. So let's kind of start from the top. We have something called a panoramic, and this just takes a picture or x-ray of your entire jaw. I can see your airways, your upper jaw, lower jaw, your teeth, and kind of get an overall impression of your teeth. The thing is, it's not good for everything. I can't see in quite great detail the individual teeth, but I can tell some um, diseases or some lesions that may be happening from there, and it's a really good overall x-ray to take. Should be taken probably every 3 to 5 years. Other x-rays we take are called bite wings. The bite wings are of your back teeth that can show me not only if you have cavities in between the teeth or larger cavities, but also the health of your gum tooth before I even take a look. And how I know is because I can see the bone, whether it's straight across and nice and healthy, or it's been melting away like butter over time. Those are called bite wings. Other ones are called PAs. PAs are uh, an x-ray of more of an individual tooth of the entire tooth, not just the part you see in the mouth, which is called the crown, but also the root, which is in the bone. And there I can see cavities, I can see bone loss, I can see also infections of the actual tooth and see how bad or how big they are. So that's a PA, all right? More of a detailed individual tooth. Now you might hear say we have a full mouth series. Well, that includes all the x-rays of the bite wings as well as the PAs or periapicals that we actually take. Those are the main x-rays that we use. Now, we have something called a 3D cone beam x-ray, and that is phenomenal. It really needs to be the standard of care for all new patients. As of right now, it's just not quite there yet because we do the bite wings and the PAs. But with the 3D X-ray, I can see everything in 3 dimensions. I can see bone loss. I can see cavities. I can see the airway, how open it is. I can see the nasal passages. I can see the cavities. I can see root canals. I can see issues that are already happening before they truly come to be presented in your daily life at the cone beam X-ray. And so here's the good news, though. A lot of times people think this is like a uh, MRI or a CT scan in a hospital, all this radiation coming at you. No, 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 it's not. It's all digital now. I'm at least all digital, and it's so minimal. I mean, going across an airplane across country, you're getting more than a full mouth series. So don't be afraid of the radiation anymore. It's so mild, and so that whatever cost there is to it, it's worth it. It's worth that cost to make sure you have a healthy smile. So those are different types of X-rays. Don't be afraid to get them, and now you know kind of when we're looking at different things what we're looking for. All right.